I will introduce our recently research project, the eHypertension, a prospective longitudinal multi-omics essential hypertension cohort. The project team leader is Professor Xiangqing Kong, and he is from Nanjing Medical University. As we all know, the prevalence of hypertension among adults is more than 30% worldwide and is continually increasing. The etiology of hypertension is still unclear, and human cohort-based association studies have shown that genetics, lifestyle habits, and their interactions may play important roles in the development of hypertension. Moreover, the usage of antihypertensive drugs has significantly improved the control rate of hypertension worldwide. However, the response rate of antihypertensive therapy is only approximately 30 to 50% during random therapy. The eHypertension cohort will include 2,000 patients with essential hypertension and 5 relatively healthy adults in the southern part of Jiangsu Province, China. The recruitment is dependent on general practitioners of local medical centers, who invite healthy volunteers and residents who have been newly diagnosed with hypertension during the yearly healthy check, but who are not treated with antihypertensives. The exclusion criteria were established by a team of expert physicians to create a relative homogeneous study population comprising individuals not yet diagnosed with clinical conditions, such as diabetes, myocardial infarction, and other chronic disorders. If a participant had met all the criteria and signed informed consent, physicians will perform a series of clinical assessments. Meanwhile, a nurse can help the participant to complete the baseline questionnaires designed for collecting data, such as basic information, lifestyle habits, and environmental, health, and psychosocial factors via a face-to-face interview. In addition, fasting blood, stool, and urine samples are collected within 2 days after recruitment. Patients with essential hypertension are advised to control their blood pressure with antihypertensive drugs. For patients receiving antihypertensive therapy, they are randomly treated with calcium channel blocks (CCB) or angiotensin II receptor blocks (ARB), who are the two most commonly used first-line antihypertensive agents in China. After 1 month, the patients are invited by local general practitioners for the assessment of treatment efficacy. If the average blood pressure cannot be controlled, the treatment should be switched to another antihypertensive for another month. If it still does not work, combined treatment with ARB and CCB is recommended. Both blood pressure and biological samples have been collected at the end of each month or period. In addition to the short-term antihypertensive interventions, the patients will be followed up for 10 years to monitor changes in their health status. This slide shows an overview of the follow-up plan. Every 2 years, follow-up appointment will take place in local medical centers and comprehensive follow-up service. Then, repeated measurements will be performed, and biological samples will be collected similar to the baseline. The collection of follow-up data may be useful for many clinical questions. Here the tables show the characteristics of patients and healthy controls. 950 patients with essential hypertension and 300 healthy controls were recruited, and 57% of patients were women. The mean age was 33 and the mean BMI was 24. As the recruitment of participants based on the local medical centers, we applied the principal component analysis to assess whether there are significant bench effects between centers. However, results showed that only a limited difference in the fourth principal component between centers. Here is a summary of our study. The first is that it is an essential hypertension cohort with multiple layers of omics data collected and will be followed up longitudinally. The second is that randomized antihypertensive intervention have been set up. The third is that it is a unique cohort for studying the etiology and clinical outcome of hypertension. The last is that antihypertensive interventions may contributed to the development of prediction models for personalized antihypertensive treatment. That's a brief introduction of our cohort announcement. This work was published on the journal iMeta, and we thank that iMeta group accepted our work and published it. Thank you so much. Thank you all.